Hi everybody, Dr. DrAhmad here from the clinic, and today I have with me my patient Barry. And Barry has a few concerns that he wants to discuss with us. So Barry, when you made the appointment to come in and visit, what was on your mind? What did you think? What were you looking to have?
I feel like I was just looking a bit older, well obviously, but so the volume loss under my eyes, volume loss mid-face, and maybe a bit more kind of masculine jaw. I was kind of wanting more kind of square.
So one of the things that we're doing, and Barry, you identified the things, is that you've definitely got a loss of mid-face volume here. And that loss of mid-face volume is causing hollowness up here and also the development of a tear trough area here. It also causes the nasolabial line, so by replacing the lost fat pad, what we can do is, by specific deep injections, we can actually lift that area there, soften the hollowness up here, and by doing so, we'll lift that there. You mentioned to me that you want a more masculine jawline, which means that you're obviously very keen to ensure that the upper face and the mid face is also got a masculine perspective. You've got a great cheekbone up here, so when we're replacing the volume here, what we have to do in order to ensure that we maintain or enhance our masculine features is that we will then probably go right at the back up here and probably give you a bit of an enhancement up here as well. And that enhancement does two things. One, it helps lift the jawline up here, and secondly, it maintains the masculine features. So rather than when we're sort of doing filler and females, we concentrate around the front here, which I call the fountain of youth, and they like that area, but men like to have a smoother area here and a bit more prominence up here. The dynamics in male rejuvenation are different, from female rejuvenation, and Barry's been quite clear about enhancing his masculine features. He's very lucky in the fact that he has got a great square chin here, he's got a lovely jawline here, great cheekbone up here, so it's not going to take much work for us just to enhance that. Barry, also when we've done a bit of enhancement here, what I may use is small, what we call mono threads, and what we can do is pop them along the jawline as well, and that gives it a lot more definition coming up. But what we'll do is we'll try and enhance this up here, got a bit of laxity here, we'll try and see if we can volumize and bring that, and then if necessary, we can put a few more of the monos in here to do that. Not going to touch your chin, I think is absolutely amazing. We have this philosophy, if it ain't broke, don't fix it. So all we're going to do is just a little bit of enhancement up here. How does that sound?
Sounds good, thank you.
Okay, let's get started. So Barry, I've done my markings and some drawings. Just before we start, and I will show you a mirror, I want to highlight a couple of things for you. This side jawline is actually higher up than this side to start off with. Now, to have facial asymmetry is actually quite common. Most people, both sides of the face will be quite different. So as we can see, Barry's jaw on one side is slightly higher up compared to the jaw on the other side. We'll not be able to make them the same, but we can try and create a bit of symmetry. And it's always great to advise this to the patient as well and to show them. So I think if we were to look up here, do you see the difference between the two sides? So that will sort of put that will maintain that, and also incidentally, you've got more volume loss on this side than you have on this side here. So what we're going to do today is that we will tailor the treatment to try and get a bit more balance, a bit more to enhance his own features, but there will still be that asymmetry there, but we will try and create more of a balance, trying to reduce some of the asymmetry, but we'll never take it away. Always great to point this out to the patient before you start, so there's no repercussions. This side looks different, this side looks like this. It gives you a good result at the end. Thank you. Okay Barry, so what we're going to do is we're now going to start with replacing the mid-face volume, because that has an impact on everything. It will have an impact on the tear trough, it will also have an impact along the jawline, as the volume loss will lift everything up. Okay? Put the injection we're on to the bone, and what we're doing is we're just aspirating just to make sure there's no blood vessels there, and we'll just put a small lines in. Male set cheekbone structure is quite deep, does require a bit more filler than going in when you're treating a female face. So we are having to put larger quantities in, probably a bit dispersed apart in slightly different injection points here. So by what we've done is we've not even treated your tear trough, all we've done is just sort of replace the lost volume over a specific fat pad. And I don't know if you can see, without even treating the tear trough area directly, we've actually reduced a lot of that as it is.
Yeah, that's great. That's a big difference already, yeah.
Yeah, so we'll continue as we are just now.
Thank you so much.
Right, Barry, so that is as much as I would like to do today.
Okay.
You'll probably get a 4-week visit up where once everything is settled down, what I call it is a tweakment, not a treatment, but a tweakment, where we just put little adjustments in to finish off what we've done, because there has been a lot of filler that's gone in there. So there you go, what do you think?
You got like a difference. So square in it. Obviously a bit swollen, but yeah, it's looking great.
Everything's
amazing,
softened, so the tear trough softened, nasal labels are softened, a bit more prominent of the jawline.
Yeah, it's amazing.
We'll let it all settle down, and then possibly in 4 weeks' time, what I might do is bring you back in and just put a candle, it's just to finish off the tear trough. I don't think we need to do that there, and I think that's absolutely fine to be an enhancement.
Thank you so much, it's amazing. Thank you.
Pleasure.
Thank you.